Thank you very much. I really appreciate and I'm honored to be presenting to you this afternoon. And I want to especially thank Lieta and the organizing committee for all of the arrangements that you made for me and all the other speakers who have visited, coming to Mexico City, many of us for the very first time. So, my program is a program that is funded by the National Library of Medicine, which is a U.S. government agency. And the purpose of the program is to support health sciences librarians and to support health information access across the United States. Some of you may be familiar with resources that the National Library of Medicine produces, such as Medline PubMed and Medline Plus and Espanol. So are any of you familiar with or use those resources? Okay, just very few. Oh, few. Good. So the program that I work for is called the National Network of Libraries of Medicine, and the United States is divided up into 8 different regions. The region that I'm responsible for is the center one in the purple. So there are 6 states that make up my region. And what the whole program is responsible for is developing programs to improve health information access. And to do that, we work with medical librarians, we work with unaffiliated healthcare providers such as dentists, pharmacists who may not have their own medical library to go to because they are practicing independently. We work with public librarians, we work with school librarians, we work with community college librarians, and these are schools that have 2-year programs that develop programs in order to produce licensed practical nurses and technicians such as emergency medical technicians. We also work with staff at community organizations that also have the goal of improving health in their own community. This is a picture of the library that I work at. And so today my presentation for you is going to be from the perspective of an academic health sciences librarian and also as a person who works for a national program but manages it on a regional level. And I have an objective for this presentation, and my objective for you is that you will learn something new about how health sciences librarians who work at a university are involved in the healthcare field. So, what do you notice about this picture? You may notice that all of the shelves are empty. Where are the books? We did a study in my region, and we found out that 85% of the academic health sciences libraries are collecting materials in digital format. 85% are collecting journal titles in digital format, and 70% of the academic health sciences libraries in my region are collecting electronic books. So I'm not saying that they've gone totally to electronic journals or electronic books, but they are definitely moving in that direction. So why is my colleague smiling? My colleague is smiling because she no longer has to shelve or have her staff shelve books. She no longer has to worry about overdue materials, and she no longer has to worry about hunting down those misshelved books. But as many of you who I'm sure are involved in managing or licensing electronic materials, there are issues involved on that side. So we have the ever-increasing costs of licensing materials and having these packages that are being licensed to us that include resources that we know no one will ever use. There's also the issue and the challenge of providing access to our client or user population who wants it wherever they are and at 24/7. So I think that for health sciences libraries, definitely we are moving to all digital collections. So academic health sciences libraries work with different populations. Of course, we work with students, and we work with students who are training to become physicians, nurses, dentists, allied health professionals such as physical therapists and occupational therapists. We work with nutritionists, we work with public health professionals, and also students who are trying to become pharmacists. And we are working to instill in them lifelong learning skills. As university librarians, I'm sure you are trying to do the same thing for your students. Health sciences libraries, in addition to wanting to instill lifelong learning skills, also want to instill skills so that they practice evidence-based medicine. And then to do that, we provide them with training on using bibliographic databases such as QuickBooks, such as PubMed. We train them to use resources that cover systematic reviews. We provide for them resources such as the basic textbooks in the different specialty areas. And also, what I think is very important is this area, which is training them to look and evaluate the resources, the content of the resources that we provide for them. Of course, in addition to working with students, we also work with faculty. And one of the important things in academia is the accreditation process. So librarians are involved in committees that when the school programs such as physicians or nurses go up for accreditation, that they are involved in that process too. The accreditation process is always, or the accreditation criteria at universities or health sciences programs always involve having a librarian to provide support for the school's programs. And these are some of the examples of different professional organizations that accredit different school programs such as physicians programs and nursing programs and pharmacy programs. The other area that we're very involved in is also in curricula. And as with you, we provide resources to support the curricula. We are also involved in sitting on committees when the different schools are looking at changing their curricula. We're involved in developing new curricula with the schools, such as with health literacy and interprofessional education. And interprofessional education is a program where you bring together students from all of the different schools in order to take classes together in fundamentals such as anatomy or physiology. Or in our case, what we're doing is we worked with the schools in order to put together a simulation program. And under this program, what happens is we identify or we bring in a standardized patient, either from the community or it may be somebody who's in the theater department, and we give them information about the role they're supposed to play as a patient, and then the student team, made up of physicians, nurses, and others, meet with the patient, identify or make a diagnosis, and come up with a treatment plan for them. One of the big things among the universities and even in the health side of universities in the United States is distance education. And I'm wondering too if your institutions are also involved in distance education for your countries. We're involved in providing resources to support that curricula. We research changes in how you go about developing a distance class based on an in-person class. Many of the people in the United States are what we call non-traditional students, and these are people who may already be working, who are living in a city or a town that is not close to a university, and they don't want to move, or they can't afford to move, or they don't have the time to take classes full time. So the universities are reaching out to these students in order for them to get new degrees or to get advanced degrees. So what librarians are doing are they're putting up learning management or participating in putting up learning management systems. And these include course materials, readings, videos, discussion boards that students can access on their own time. And this is an example of what is called a library guide, where the librarians pull together resources on a specific topic. This one is evidence-based practice, and so that the student who's interested in that topic has all the resources that they need in one location. Research is a very big deal for academic institutions. And I found out that the top 5 recipients for grants or funding from the U.S. National Institutes of Health received $2.5 trillion last year. I really have a hard time wrapping my head around $2.5 trillion. The University of Utah, my institution, receives about 42% of its grant funding from the National Institutes of Health. So it's important to the institution, and because it's important to the institution, it's also important to health sciences libraries to support the research effort in health sciences. So health sciences libraries, this is a grant life cycle, or you could call it a research life cycle, and health sciences libraries are involved in every facet or every part of that cycle. So we provide what the latest research is on a different topic. On different topics, we provide resources and teach faculty on how to find out what is being funded and how much funding and who is funding. We provide research on who else may be working on the field within our own institution or other institutions, so that our researchers can find partners. And I heard yesterday that being an embedded librarian does not translate well into Spanish, so I'm going to say that we become partners of research teams by providing resources and assistance in managing data. We heard about big data this morning, and in managing and helping to organize the results that come out of research. And also just answering questions that the research team may come up with as they do their research. The National Library of Medicine actually funds librarians to become part of research teams. And I have an example here. This is a blog that is written by a librarian who moved from working in an academic health sciences library to becoming part of a research team. And her blog is called A Librarian by Any Other Name. And so what she does in this blog, and it's a very interesting blog for anybody who is looking to make that transition, about the challenges that she's had in order to find her niche or find her place within the research team to be a partner there. Librarians also support the research that results in commercialization. And this includes biotechnology, different inventions, new drugs. We may be providing patent information. The example I'm going to give is the innovation and research librarian at our institution. And what she's doing is she's working with faculty and students who are developing video games for therapy. And we don't call them games, we call them digital therapeutics, because it sounds more professional. So the people who are involved in developing these digital therapeutics are programmers and they're web developers. So they have no idea what the healthcare environment is like. They don't know diseases, they don't know treatments. So the Health Sciences Library provides them with resources and assists them in increasing their knowledge of the therapeutic game that they're supposed to be working on and everything that surrounds developing that game. For example, one of the things that they were very unaware of is the Institutional Review Board, which on campuses is a group of individuals who reviews all of the research that goes on involving people. And they do this in order to ensure that, one, the privacy of the person is protected and that the research itself is ethical. So our librarian here is actually testing out a treatment method that is supposed to help improve reflexes. And so she's not just playing around, she's actually helping with research. And I think she has a great fun job. So universities also have hospitals and medical centers. And so the librarian is involved not just in supporting the academic side of their university and healthcare, working with students, faculty, and staff, but is also involved in providing clinical support. Like the academic side, hospitals are also accredited or are ranked, and UHC stands for University Health System Consortia, and what they do is that they rank university medical centers. The Joint Commission is an accreditation body for medical centers. And so neither of these bodies requires that the hospital or medical center have a librarian or a library. But they do require that the facility or the institution provide staff with access to health information. So on the hospital and medical center side, librarians are involved in a lot of different committees. They are involved in committees that develop patient care guidelines and policies, in developing patient safety standards, in helping to create systems that manage the knowledge within the institution. And they also work on purchasing committees in order to help the committee compare products that the institution may be interested in purchasing. I'm not sure that all of you are aware of the healthcare reform that is going on within the United States, but this reform is meant to address a serious problem where the healthcare in the United States is probably one of the most expensive in the world, but on the other side, the health of its people is not one of the best in the world. And so our federal government is trying to institute or implement different processes in order to raise the health level of our community and also lower the cost of health care. So librarians are also involved in helping their institutions address this issue. There are different criteria that the federal government has come up with that pertain to reimbursement of treating certain kinds of patients, and this is where health literacy and the librarian can assist. Just for example, there are criteria for how well a nurse communicated with the patient, how well a physician communicated with the patient, and also how well the patient understood the discharge instructions that were given to them when they were discharged from the hospital. A major focus of the healthcare reform is not just looking for facilities to implement electronic health records. They're also very interested in that what we call meaningful use criteria, or that the institution effectively uses the electronic health record. And here again, there's a criteria where librarians have become involved in, and that criteria is that through the electronic health record, the institution has to identify patient-specific resources and provide those resources to more than 10% of the patients that are seen by the institution. So this is done from a link within the electronic health record. In addition, health sciences librarians are involved in what we call an info button. It's kind of like the link that is provided for patient education, but this is a link to resources that is written for both the healthcare provider, physicians, nurses, etc. So it provides more technical information for them as they're treating the patient. Librarians are involved in working directly with the patient care team as part of the patient team in working in treating patients. They go on grand rounds with the healthcare team, and they're also involved in morning report or discussions of conditions that were seen that day by a patient care, a healthcare team is discussed. And so what happens is, because the librarian is right there, they hear the question without having the healthcare provider contact the librarian. And so an answer can be given either at the moment, or if it's a more complex question, the answer can be provided within the same day. Us within the academic side, librarians are also involved in training the hospital staff in how to practice evidence-based medicine when dealing with a patient. And in some cases, they're actually responsible for managing the continuing education for the hospital staff. And as Kathy talked about just a few minutes ago, librarians are also involved in providing information to patients and their family members. They may do this directly, or they may be working with a healthcare provider, providing the healthcare provider with information that's written on a patient level that the healthcare provider then can give and pass on to the patient or family member. And in some cases, what happens is that the healthcare provider will actually write a prescription, just as they will for information, just as they would for writing a drug, and give that paper to the patient or family member, who takes it down to the library to be filled. So finally, and this Kathy pointed out too, hospitals are members of the community. And as a member of the community, they get involved in healthcare and other events. And as a part of a hospital, librarians also are involved in attending those events, either providing services or encouraging people to use those services as a patient resource, or else providing information as the hospital may give tests, like for blood pressure, providing information on blood pressure itself. So that concludes my talk, but I have one question for you, and that goes back to my objective that I identified at the beginning of my talk, and that was that I was hoping that you would say that you learned something new about how medical librarians are involved in healthcare in the United States. And so could I see a show of hands to see whether or not you learned something new? Thank you, Oscar. Okay, thank you very much.